Hello, my name is Joel Amani and I'm from Parathon, and I'm so happy to be part of this upgrade project for the children's ward along with Doreen and Melanie.
Hi, Doreen Cooper. I'm part of this organising committee here to look at what the hospital has or hasn't got for the children's ward, and we are organising an event to raise funds for the children's playground at the children's ward here.
I'm Melanie Champion, and we thought we'd bring you here today so we could show you exactly what the facilities are here in this ward, and we'll take you outside and show you exactly where we'll be building a playground for the babies in this ward, with thanks to all of you that have attended tonight and are sponsoring this amazing event and this amazing cause. I'm here with Sister Anna, and she's the head nurse here at the children's ward. Sister, how long have you been a nurse in the children's ward?
I've been here about for 16 years.
16 years, wow. And has the hospital changed in any way in that 16 years?
Yeah, I think a little bit changes through help of some other outside people.
Yes, so different organisations have helped you. And do you have enough equipment to treat all the children that come through?
Concerning the equipment we just limited equipment, those things like pulse oximeter or suction machine are donated items we receive from other organisations as well.
Okay, so you could do with a lot more equipment. How many children do you have coming through the hospital at any one time?
In the pediatric ward we have a total bed of 32, but not all of them occupied during a day, but when it comes to outbreak, we might have some overflow of patients. We have to put them in some other department as well, or create some spaces for them.
Right, so you definitely need more space in here, bed space as well. And what type of illnesses do you treat?
In here we treat cases like malaria. The most common ones are the pneumonia and meningitis, some TB patients as well.
Okay. All right, thank you, sister.
Thank you.
So what many follow dream inside this follow room specifically?
Inside this room, we follow a procedure room where all those procedures doctor want to do with the patient inside Honiara. But before you do procedure, you need water for wash. And
That's
after
right.
you completing procedure, you need for wash.
Absolutely, yeah.
Right.
Why is that? Because the tap's broken or because there's no water?
No, the problem with the tap. So we follow order through auto maintenance, but operator always say that you need to pay no money, selling for replacing the auto taps. No more air conditioning inside the place.
So how long have you been waiting for these taps to be fixed?
Almost 3 months now.
3 months?
Yeah.
In the children's ward? No water?
No water. We will have to go fetch water somewhere or water come put in the water.
That doesn't cost much to fix the taps. But they've been waiting for 3 months to have it fixed.
Yeah.
Air
And
conditioner. So
yeah.
whole department we follow without air conditioning. Inside the pharmacy, stock room, no aircon. Milk room, when we follow all this preparing milk for babies. No any air conditioning too. So those things then we follow request over the just we follow the request, no one say no more money.
No money to fix 2 taps.
That's what they are telling us.
This is unbelievable.
Dr. Titus Nasi, I'm the head of Peadatrician for the National Referral Hospital and Chief Peadatrician for Solomon Islands. And I'm very happy to have Melanie here and the team discussing about what could be done to improve our playground for the kids, as well as trying to set up a foundation for a health foundation for the hospital and for our patients. We have a lot of patients that come in quite stable, active, and especially in terms of our malnourished babies. Part of the treatment is play therapy, and at the moment we don't have a space for them to actually be entertained, motivated, and do things to improve their health outcomes at the end of the day. And that, I think that's very important, and I'm grateful that we are planning to do this so that it's an increase in terms of treatment for our kids as we continue to try and improve the care for our children. And thank you, Melanie, and Power FM and Deloitte and all the other sponsors, Doreen, for organizing this for the hospital. I'm very excited about going forward with the things for the children's ward in terms of trying to build a playground for the children. It's something that we never had, and we're still trying to get it established. And thank you for coming on board with us on this project. And it's good for our patients, of our kids, in terms of staying in the hospital. They don't have a space to really play, and especially some of the long-term patients that stays in the ward. And I'm very thankful that you are able to come on board with us in terms of trying to do this and establish it.
We are now outside the children's ward where the playground is going to be planned and built, hopefully. And we've got a nice bit of land here. It's quite big, as you can see. This wall here is very close to it, and we need something done about this wall. Perhaps a retaining wall as well put in here, so that when the sea is rough, it doesn't wash the rest of the land away. So I'm hoping that we can get enough money to do this work.
So we intend to build a playground out here. It's a children's playground. We'll put a fence around it. We'll get rid of the washing line, clean up the grass, and the doctor has told us, the head doctor of the children's ward has told us that if there was a playground for the kids out here, it would help them with their healing. So we have to make it undercover because it's very hot in the Solomon Islands, especially in Honiara. So we're building an undercover area, hopefully with a plastic playground. We can't have anything metal so the kids don't hurt themselves, and a soft flooring. And hopefully that will help some of those sick kids in there with the healing process. As you can see, the hospital needs a lot of work. It needs your support. We thank you so much for supporting our cause, and we will put the money to good use. We will build that playground for the kids and hopefully help them get better.
And this project is something that we are really, really passionate about, and we would be really, really happy if you come on board and support us in this great cause.
Thank you for coming on this tour with us to the children's ward and the playground area. As you can see, it needs a lot done, and we hope that with our appeal to you that you would support this initiative and this project and make Solomon Island children very happy. Thank you.
It doesn't end now. After this event and moving forward, we're actually going to start a foundation specifically for the children's ward. Dr. Titus and Dr. Rooney are very excited that the foundation is finally getting off the ground, and they will be on the board of directors. So please continue to support the children's ward at the National Referral Hospital, and thank you.